This video will guide you on how to create a healthcare home's digital care plan using the Inca Coordinated Care platform. The Precedence Connector examines the patient record to determine the current status of the patient. Pop-up will display a summary of the chronic conditions along with other alerts. If you would like to generate this pop-up again, select the Precedence Connector, then select Check Status. To create a health record, select Create in Inca. Choose the patient's GP and select Next. Confirm patient consent. If they require more information, select the information icon. Enroll the patient in the healthcare home's risk stratification and select Create Health Record. A health record has now been created. To create a healthcare home's care plan, select Create Care Plan. Select Care Plan Type, Healthcare Home Care Plan. Confirm patient consent and select Next. The conditions for the patient will be pre-selected. Any custom conditions can be added to the list by typing the conditions and clicking Add. When you are complete with the conditions, click Next. Based on the conditions selected, the care team will be populated. To replace a member of the care team, select the pencil icon. You can easily choose an alternative member of the same specialty from your preferred providers list. You can also search for other providers in our provider directory. You can search via provider name or organisation or city, suburb and postcode. Select the provider and click Assign. If you cannot find the provider that you're looking for, you can register a new provider. Clicking the bin icon will remove the provider from the care team. If you would like to include a new care team member, click the Add Care Team Member button. Once your care team is complete, click Next. You will be prompted to verify the review dates for the care plan, then taken to the care plan page. This care plan is pre-populated with goals and tasks based on the conditions entered for the patient and is completely customizable. Click on any text to start inline editing. You can change the provider responsible for an individual task, change the task frequency, add or schedule appointments, and add comments for the care team. By selecting the bin icon, you can delete any goal or task. You can also add predefined or custom tasks, along with custom or predefined goals. If you require more information, see our Editing the Care Plan video. Once the care plan is complete, select Next. Nurses creating the care plan can choose to either release to the GP for approval or approve on behalf of the GP. Allocate Medicare-funded allied health sessions as appropriate for your patient and select Next. Clicking Next will confirm the approval of the care plan as well as automatically sending digital notifications to the care team that they have been added to the patient's care plan. If you are a nurse, the GP will have to electronically sign the referrals in Inca. All care team members are notified of their inclusion in the care plan. Care team members can securely sign in to the Inca platform with their own user credentials, where they can access and contribute to the patient care plan and health record from any location. With the live digital care plan, the care team now can effectively coordinate their activities and ensure proper follow-up and review of the patient.